Welcome to the Health Hub with Dr. T. As you all know, I'm Dr. T. Thank you so much for joining this evening, Monday evening. Now I have something to look forward to on Mondays. So today we're talking about maximizing your health benefits. I'm going to start with a question, which is, who in the chat here has used their free checkups this year? So if you've used your free checkups based on your insurance, put a thumbs up or put a hand up in the chat so that we can see who all has used it. I'm going to dive right in to see what is health benefits. What does that look like? I'm going to give general information because there's so much information when it comes to health benefits, but I'm going to try to give information on how to navigate that. Oh, Addie Baby, good job. Good job for using your free checkups this year. So as we know, or most people have insurances through their company. Some people do reach out individually and get their own health insurance. With that, we'll talk a little bit about copays. We'll talk about deductibles. We'll talk about co-insurances, out of pocket. We'll talk about all of that pretty soon. But first, I want to just share some free checkups that most insurances give throughout the year. Again, this is all dependent on your plan. Everyone in the room could have Blue Cross Blue Shield. We're going to use Blue Cross Blue Shield tonight. Everyone here could have Blue Cross Blue Shield, but we all could have different plans. For example, if you work for Walmart, or if you work for Best Buy, and you work for, let's pick another one, Ross, and they all utilize Blue Cross Blue Shield, does not mean that all the benefits are the same. What that means is each company has come up with their own package with Blue Cross Blue Shield on what they want that package to look like for their employees. So when we talk about insurance, we're talking about insurance as a whole, but do keep in mind that every plan is different. So I'm going to run through some mostly free checkups that you get throughout the year. Maybe some could be once a year, some could be twice a year. Your annual checkup. Your annual checkup is it falls under preventative care. So your annual checkup should be covered by your insurance, at least one checkup a year. And that is important. Last week we spoke about with men's health, they talked about the annual physical. That's part of that checkup that your insurance will cover. Mental health coverage. As we know, mental health is real. There's so much that has happened, from COVID to different types of vaccines going on. There's so much mental health issues out there. And most employers are now stepping up and having some of those sessions be covered. Does that mean all your sessions 2 times a week for 6 months will be covered? Maybe, or maybe not. But that you have to see what they cover. Some may cover a few sessions, some may cover up to a full plan of care. It all depends. But most insurances are covering some mental health. So please, that's something that you can definitely check out with your insurance. Dental. I hate going to the dentist, by the way, but most of them do allow 2 free cleanings. Now, when it comes to root canal and it comes to braces and some other things, it may get a little bit more tricky, get a little bit more expensive and not necessarily free, but your cleaning does get covered throughout the year. There's at least 2 for most insurances that gets covered. Vision is another one. Doing your eye test, making sure that you are good. That's another benefit that you get with your insurance. And not only do these benefits go to you, if you have your family or your spouse on your benefit plan, they also benefit from these free. So it's not necessarily one annual checkup for family, it's one per person, depending on who is on the benefit package. Gym, fitness, or wellness also included in your wellness and in your benefit package. Some gyms or some plans may say, go ahead and pay for your gym membership and we are going to reimburse you. Some may say, you get a discount if you use X amount of jeans. For example, if you use Lifetime Fitness or something, they might say we have a discount that you could use with Lifetime Fitness. So that's another benefit. So those are the commonly overlooked benefits that most of our insurance plans do cover that we probably don't take advantage of. And we should. That's another way to stay mentally healthy, physically healthy, wellness check, our dental, our vision, all of that, staying up to par with our health. That all plays a big role. Preventive care is better than reactive care. In our first live, we talked a little bit about that. We want to kind of stay ahead and not try to just find a cure for a sickness, but to get ahead of it. And that's one way that we can get ahead is by using these free checkups yearly, annually that your insurance covers. I'm going to step back a little bit and talk a little bit about your insurance. When you sign up for benefits with your insurance, you should receive a card. Everyone receives their benefits card. And the front of it tells you your plan, tells you if you see a specialist, what the copay looks like. If you see your PCP, what does that look like? If you have an HMO, PPO, those kind of things are on your card. On the back of your card is where you get your member information. So that's the number. That's where you find the information for if you have a question in regards to your benefits, who you can call. From there, you would be able to contact them and ask them any and every questions you may have. How many visits do I get in a year? How much is my copay? And how can I see an in-network versus an out-of-network provider? All of those questions can be answered by the insurance if you call the member service line on the back of your card. Your ID is on the front of the card, so you can definitely, once you call in, have your card ready. Most insurance companies need that ID in order to go into your account. If you have an account that is under your spouse or someone else's, you also need to have the right information to be able to get into the account. They may ask you, I believe mine is under my husband's. So they may ask me, oh, what's your husband's name and date of birth in order for me to get into the account. So be mindful and have all your information once you call them so that they can go ahead and answer all the questions that you need. When it comes to insurance, timing is important. I know we have a couple of doctors in this chat, in our comments. Doctors get booked up really, really quickly towards the end of the year. You want to be mindful in when you book your appointments. Most insurances, like I said, there are different types of plans. Most insurances are calendar year. So they're from January to December. So every year, your benefits may start back over in January. For some, that may not be calendar year, maybe contract year, meaning that maybe the year starts in June, ends in May. That's just kind of how the company has set it up. So timing is important. If you're under the calendar year, meaning that your insurance starts over every January, guess what? Everyone is trying to get all these free checkups in towards the end of the year. So doctors are going to be very, very booked. Once it gets to October, November, December, everyone's trying to get their eyes checked. Everyone's trying to see the dentist. Everyone's seeing their PCP. They're trying to get through to their doctors. So your wait list might be a little bit longer because you waited to the end of the year. And that way you don't even feel rushed at your doctor's appointment. I don't like going to the dentist and they're like, oh, okay, thank you so much. They're just trying to get me in and out. But I know it's the end of the year, so they have a really jam-packed schedule. So what I try to do is see if I can go mid-year, right? That way I get some one-on-one time with my doctors. The office isn't really busy. The clinic aren't rushing me in and out. I'm able to really voice my concerns. So take a look at when your benefits are. Are you calendar year or are you contract year? If you're contract year, then while everyone is rushing towards the end of the year, you can take a little step back and say, well, I'm contract year, so I can go in February or whatever time is most convenient for you. But that way you're not going when everyone else is going, because majority of the people are calendar year. October, we're talking about timing. October is open enrollment. Even if you've been with this company for 10 years, you still have to either opt in or opt out of their insurance, because things happen, things change. Maybe you had a baby, maybe you got married, maybe you got a divorce, maybe whatever. There's so many different situations that could have happened. So October is most insurances open enrollment. So in October, go ahead and make sure that you are signed up for the next year. I remember when I was pregnant, I was about 7 months pregnant, 6-7 months pregnant, and we forgot open enrollment. And so it was like, and we didn't even realize it till the doctors, my OBGYN called me and said, hey, you're gonna have to pay out of pocket because you don't have insurance. And I was like, what? What do you mean? I have insurance. And so they supposedly sent letters and things to our house. We didn't get it, but they said we didn't sign up for open enrollment and we missed the enrollment. Therefore, they kind of took our benefits away. You don't want that to happen to you, whether or not you're pregnant or anything like that. Just your general health. You want to make sure that you stay on top of it. So now in October, I'm like, ding, 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 ding. Have we signed up for open enrollment? Have we done all the things that is needed in order to make sure that we still have insurance? So October is open enrollment. If your company has a different date, call them, ask them, and just say, what date do I need to know so that I can ensure that I have insurance for the upcoming year? So that is timing. Timing is important. Please know when your what year your company runs on. Is it calendar year? Is it contract year? That plays a big difference in when you can go and see your doctor, where it would be rushed and you would kind of feel like your voice is being heard. Let's talk about the big part of insurance. Let's talk about maximizing financial value, money part. What is deductibles? What are co-pays? What are co-insurances? What is out of pocket? What is the HSA account? All those things are important. Depending on your plan, depends on your type of deductible. You may have a high deductible, you may have a low deductible. Most insurances or most companies, will give you an option on which way you want to go. For someone that doesn't get sick often, right? They might say, I want my monthly payments to be low, and so I'm okay with a high deductible because I really don't go to the doctor, thank God. There may be some that are like, no, I can't afford this, or I can go higher so that in the long run, I don't pay as much. Whatever the case may be, you have to look at your financial status. You have to look at what you can financially afford each month and pick the appropriate plan if the company gives you options. If they don't give you options and you're picking with whichever option they're indirectly making you pick, then you just have to budget accordingly to ensure that your health is number one. So deductibles are important. If you go somewhere, let's say you go for an MRI and you haven't met your deductible, you're definitely going to pay towards your deductible before the insurance covers a good amount of it. And so that is important. Some people may say, I get patients that ask me all the time, I paid my monthly bill for my insurance. Why do I still have to pay my deductible? Well, that's what your company signed up for, and that's how they've structured it. And so you do have to meet your deductible before the plan starts contributing to your care. Let's do some math. Hopefully my math is mathing today. If your deductible is $500, right? And you're like, oh, I pay, $150 every paycheck out of my check. That $150 is not going towards your deductible. It's the services that you are receiving that will go towards your deductible. Once you get to that $500 of your deductible being met, then the insurance starts contributing whatever percentage that they do. Could it be 80%? Could it be 20%? Whatever they have told you when you sign up for benefits, that's what they're going to contribute. So be mindful of that. Some places may say you haven't met the deductible. This MRI costs $650, but guess what? That entire amount goes towards your deductible. Great. By the time you leave the MRI, you've met your deductible. The insurance starts paying towards services. Some places you may go and not all of the money or all the services rendered there may go towards your deductible. So that's, again, based on the insurance. That has nothing to do with the clinic. Some clinics may know some services go towards the deductible, but it's never 100%. If you want 100%, you have to ask your insurance. Okay, I'm going to go get an MRI. Is whatever I'm paying here going to count towards my deductible? They will be able to give you the most accurate information. Why? Because they know your plan and they're able to see what services, what codes you're using, which doctors you're using, and see if that goes towards your plan. Give me a thumbs up if you kind of understand what I'm saying. Drop comments, questions, statements, anything in the comment section. We're not heavy today, but it's still good information. Okay, so we talked a little bit about copays. Let's talk about copays. Copays, yes and no, may go towards your deductible, but that's just kind of standard for most places. They're saying, hey, whenever you go see a doctor, it's $25. That's what you have to pay. It's not negotiable. I have patients that tell me all the time, I don't want to pay my copay. Then I can't see you because the insurance isn't paying 100%. They're paying a percentage, and with your copay, then I'm most likely getting my 100%. So if someone doesn't want to pay, if you don't want to pay your copay, you're shortening your doctor, dentist, whichever service you're going to. So please pay your copays. It all depends. Some people's copay can be as high as $75. Some can be as low as $15. It all depends on the plan. That's what determines your copay. If you see a specialist, your copay may be higher. If you see a general GP, a general practitioner, your copays may be less. In-network, out-of-network also plays a big role. If you go to an in-network provider, your benefits may count more towards it versus going to an out-of-network provider. Then you're paying for out-of-network benefits, and most companies don't want that. They want you to go to an in-network provider, someone that the doctors have already said is in our network. We want you to go see them. When you start going outside the network, makes it a little bit more, could be more costly for you, because now you're going outside the network that the company has created for you. Now your copays, your benefits may cost a little bit more. So be mindful of that. If you have a doctor that you love so much and you're like, this has been my doctor since 3rd grade, I'm not going anywhere, then you can go ahead and do out of pocket. You weigh it and see what's best for you. If you're like, no, cost is really important to me, I want to be more cost effective, then you can definitely pick an in-network provider. Co-insurance is also similar to your copays, your deductibles. It's another percentage of what the member has to pay. Some may say after you've met your deductible, then you only owe 10% of your co-insurance, which may go towards your out-of-pocket. If you have any questions about any of these, again, I'm just giving general information. Send me a DM. If you know someone that has come to you and said, I don't understand insurance, like what am I paying for, what am I getting? Refer them to the Health Help with Dr. T. I cannot tell them specifically based on their plan, but I can give them the right questions that they can ask their insurances for the best answers. HSA accounts is a health savings account that you can only use for your health. You can pay your co-pays from there, your co-insurance, towards your deductible, all of that. That's just money aside for a rainy day for your health, which I think is something that is important. I've personally started looking into HSA accounts just because, I don't know, I'm hearing nothing but great benefits. I'm seeing that is that money that you keep just to make sure that your health is good. I think it's a great investment. It's something that I'm definitely looking into. So HSA accounts, out-of-pockets, co-insurances, deductibles, co-pays. If all these words are foreign to you, please, please, please call me. Please, please, please call your insurance. Learn about it so that you're maximizing your financial value and you're not just living by and letting things and not truly understanding your benefits. That is super important. Any questions so far? Any comments in the chat? Anyone that has, or I'm going to talk a little bit about those who don't have a company and insurance is through and trying to do it individual. So we'll talk a little bit about that. But I wanted to pause here to see if anyone's had any good or not so good communication with their insurances, trying to understand their benefit plans. Feel free to drop it in the chat, drop a comment. If you have insurance, are you using it? Are you maximizing it? Do you really know what all you're receiving? Are you just letting free money go by? And when I say free money, I'm like, that's something that's already been paid for. Why aren't you using it? Prince Kato. Plus, you can invest a portion or all of the funds in your HSA for additional tax-free growth. See, that's why I love this, because people get to share. I don't know it all. That's why I'm doing an Instagram live and not a podcast, because I want to learn and I want others to learn from each other. So that's pretty cool that we can invest a portion of our funds in your HSA or for additional tax-free growth. Who doesn't like tax-free money? And who doesn't like investment? We'll talk about investments upcoming. I believe next month we'll touch a little bit on investments. What about if you do not, what about you work for yourself? You're an entrepreneur, you work for yourself, you don't have a company that is giving you these benefits. What do? There are agents out there that can help you get insurance. You don't necessarily need a company in order for you to have insurance. You don't need a company for you to have insurance for yourself, for your family, for your children. You do not need that. There are so many agents, and we have a couple of agents that are going to come on live and talk to you all about, even having an HSA account outside of your company, or you're an entrepreneur, you're a business owner, and you're looking for insurance for you, for yourself, for your family. We have some people that will come on board and talk a little bit about that. That's good. Thank you for that addition, Priskito. Any other comments, any other encounter with the insurances that you're like, oh yes, this is great, or maybe not so much? Please share in the comments. I'm going to give a little snippet about one insurance that I was on. While I was pregnant, this is all pregnancy stories today. While I was pregnant, my insurance assigned a nurse to me. I didn't think that was possible. I didn't even know about this benefit. The nurse called me and said, hi, I'm calling from Aetna. I am aware that you are pregnant, and I just want to introduce myself to you and let you know that I will be your nurse throughout this pregnancy and out after. And I was like, what? Like, huh? I was like, who signed me up for this? Because no one has ever told me about this. And I know plenty of people that have been pregnant, and no one told me that I could get a nurse. But guess what? My plan gave me that. And she checked up on me every week. It got to the point where I had to tell her, like, I'm good. My pregnancy is fine. I'm okay. I'm going to my doctor's appointments. And she was just there. She would ask me about my mental state. You know, how are you feeling? Are you feeling anxiety? Are you feeling nervous? When I would go to a doctor's appointment, she would know. Felt like she was stalking me a bit. She would know. She would call me after my doctor's appointment. You know, is everything good? And she just, I mean, I don't even know where she lived. I don't think she lived in Houston, let alone Texas. But she was just amazing. Too amazing that I was like, I need you to back up. But amazing nevertheless, because what if I didn't have support through family, my spouse, and so forth? She was a great support for me. After my pregnancy, she called and checked up on me. Up until recently, my daughter is a little bit over 3. She saw that she has a medication in our CVS app, or I don't know how she sees it, because clearly pharmacy is linked to it. And she called and said, oh, we see that you guys haven't picked up this prescription. Is everything okay? And I was like, oh my God, like, is she my nurse for life? But that's so important. I didn't even know I had that. So that is a benefit that I think your insurance gives that could definitely play a big role. When you're pregnant, you can get your breast pumps. You can get so many things. For our elder generation, it depends on their insurance, right? Some may get equipment, a walker, a wheelchair, diapers, so many different things your insurance may cover. You just have to ask. Brielle Beryl said, I had that too and had no idea that was a part of my benefit package. I am telling you, every pregnant woman, I believe, needs to call their insurance and ask them, do I get a nurse? Because now that I've started talking about it, I'm hearing more about it through so many different people. So definitely call your insurance and say, you know, I just want to know what my benefits are. I'm pregnant. Or if it's for your parents, hey, call and just say, my dad is 70 years old. He's in need of these equipment. He's in need of these supplies. Do you guys cover it? It doesn't hurt to ask. The most they will say is no. And then you move on to the next. But I would rather the insurance covers it because I've already paid for it than for me to just go out of pocket. Now, if the insurance is paying for something, they most likely would need a prescription. So, and your doctors should be able to give you your prescription on whatever equipment that is needed. If it's a need, they will be able to give it to you. Sambo.Francis said, what is your take on Medicare Advantage? It depends. What are your needs? What are the patient's needs, right? That's another thing you can talk about before enrollment is call and say, these are the needs of my loved one. I want to make sure that this plan is able to fit whatever services they need. Are they in therapy? Are they in physical therapy, occupational therapy? Are they in home health? What does it cover? What does it not cover? This is their diagnosis. Their diagnosis plays a big role. So it all depends on their need is where I feel the plan should reach. So if Medicare Advantage works, I have patients that are on Medicare Advantage. I have patients on Medicare Advantage and also have a secondary to cover that 20% that maybe Medicare does not cover. Because remember, Medicare doesn't cover 100%, covers 80% depending on the plan. If you're plan B, outpatient. So excuse me. So that's why I said it all depends on the needs, depends on where the patient is, depends on the supplies. All of that plays a big role into making sure that you pick the right plan for yourself or for your loved one. Those are some good questions. Any other questions? Any other statements? Good encounters? Anything that your insurance paid for that you didn't even know was a benefit, or that they didn't pay for that you wish that they paid for? Because it's a lot. They pay for a lot. And we just have to tap into that. But are we scared to tap in? Are we Are we even willing to ask, or do we just say, oh, I don't think they'll pay for it, and kind of go from there? Drop your comments in the comment section. I want to hear about your experiences. I want to hear about your encounter. I want to know what benefits y'all got so that I can ask my insurance and see if I get those benefits also. Thank you all so much for joining. I'm trying to make sure that I did not miss any other questions. Okay. Most insurances also have a portal. Utilize your portal. Go to your portal. They have a patient portal. If you go into your portal, you'll be able to see what your benefits look like. You will be able to see what you're covered. You'll even be able to see the copays you've paid, the billing from the services that you've been to. It gives you a lot of information. Can be overwhelming, but could be really good information for you to have moving forward. So go kind of play around with your portal and just kind of see, there's different sections. So they might have a health section. They may have a wellness section. They may have postpartum or pregnancy section. They may have adult care section. They'll have different sections within your portal where you can click on and just kind of see which one best fits your needs. Review your benefits. Find a provider. In our last live, we spoke about how to find a provider. If you go through your portal and go to the Find Your Provider glass, most of them have an eyeglass or Find a Provider in your network. That way you're taken out of network. You're able to get someone in your network, and that goes a long way. Cost, all of that is low and more affordable. So use your portal in order for you to find providers, in order for you to understand your benefits. Use your portal to just kind of get in touch with what your insurance is. Thank you all so much for joining so far. We're talking about insurances, maximizing your benefits. We're talking about benefits that your insurance gives you that you didn't know you had. Feel free to drop any of these benefits in the chats. All right, Prince Kato said, for mental health care, check with your company's EAP program. Yes, I have it. I had it in my head and I did not say it. EAP program, there's usually a few sessions offered per mental health event. Yes. There, personally, we had to utilize an EAP for a death in the family. And so we received, I believe, maybe 6 to 7 sessions. And they were in person also. And we got to be able to pick our own therapist. We were able to change therapists if we weren't comfortable with the one that we had. But the EAP's assistance program, the employee assistance program, did offer those benefits to us. Yes, mental health, life is life in. Life is life in. And the insurance wants you to utilize these things so that they don't pay for it on the other end. So they want you to be preventive. They want you to step in and utilize it. You've already paid for it. The company has already contributed to it. So definitely use it. Thank you for that, EAP. I missed that when I was talking about the commonly overlooked benefits. So I'm going to kind of review and then we're going to get off. You can always watch this on YouTube. You can always shoot me a DM, send me a message, and I'll try to assist as best as possible. So I started with, have you used your free checkup this year? If you haven't, you still have time. We're in July. Get it done. There's nothing stopping you from getting it done right now. If you needed a sign, I am your sign for this. Commonly overlooked benefits, the annual checkups, mental health coverage, preventative care, dental, vision, employee assistance programs, also known as EAP, gym, fitness, or wellness, dietitian is also one of those. So many benefits, so many commonly overlooked benefits. Timing, we spoke a little bit about timing. Timing is important. Doctors get booked up towards the end of the year. Everyone's trying to get in. So it's hard to get you, your husband, your children, your grandma, your grandpa. It's hard to get everybody in. So the sooner you can get it done, the better. Open enrollment is in October. Make sure that you're mindful of that date so that you can make sure that you clock in and you have insurance for the next year. We spoke a little bit about calendar year versus contract year. Calendar year, January to December. Contract could be within the year, and making sure that you're aware of those so that you know when you have your benefits. We talked about maximizing financial value, deductibles, co-pays, co-insurance, out-of-pockets, HSA funding, HSA accounts, FSA accounts. That's all important. And then tips to take action are log into your portal. If you aren't sure you have a portal, you most likely have a portal. If your insurance doesn't have a portal, then you can definitely use the members' numbers on the back of your insurance card. But I would recommend you using your portal, reviewing your benefits, finding providers that you would love to use. You'll be surprised that your favorite provider is contracted with that insurance. So those are my tips for maximizing your health benefits. They're simple, but we overlook them. We get through the hustle and bustle of the day, of the year. Before we know it is July. We haven't gone to our doctor. We haven't done anything like that. This is just a reminder that that's free money laying down. You are passing away free money, and you don't want to do that. You want to make sure that you maximize, take care of yourself, take care of your health, mentally, physically, emotionally, and all of that. And that starts with the insurance, especially if you have insurance. We wrapped up talking about if you're an entrepreneur or you're an individual and you don't have a company that has that's offering insurance, you can still get insurance. You can work with an agent one-on-one, and they will come up with the best plan for you. So that is just an overview of maximizing your health benefits. This is your sign, like I said, to utilize this free money that is in your benefit package. Personally, if you aren't sure when during the year to do these things, make it your birthday month. You know, it's easier to say my birthday month, I'm going to go get my checkup. For women, I'm going to go get my mammogram. I'm going to get my teeth clean. I'm going to do all of that self-care, mental health, physical health, all of that done during my birthday month. That way you know that it's annual and it's easier to remember. Thank you all so much. If you have any questions, if you have any comments, please feel free to drop them in the chat. But I hope this has been helpful. I know it's not a crazy, wild topic, but it's an important topic because you need to know your benefits for the future. In case of anything, you need to know how to find it. You need to know what it means. So thank you all so much for joining. I know it's Monday night. I appreciate it. Share this page with everyone you know. Thank you for those that share. We have a YouTube page. Feel free to get on our YouTube page. Feel free to share with everyone. We really, really, really appreciate it. When I say we, I mean me. I appreciate it. Keep spreading the word. Thank you all so much for spending time with me today. Thanks, Dr. T. Oh, Prince Kato. Sambo Francis, you're welcome. You're welcome. Feel free to, I know you had questions about Medicare, so feel free to shoot me a DM, send me a message if you want to chat some more. We definitely can do that. But thank you all so much for joining this evening. I truly appreciate it. Have a blessed rest of your week. We're talking next week about skincare. We have a dermatologist that's going to be in the house. It's summertime. Everyone's talking about aging. Everyone wants to look good. So we do have a dermatologist coming on next week to talk with us. So thank you all so much for coming. Thank you so much for joining and staying. I appreciate it so much. Catch us next week, Monday, 8:30 p.m. Central Time on the Health Hub with Dr. T. Thank you so much. Have a good evening. Bye. Thank you. Bye.